everyone. I think we'll get started. Sorry for interrupting. So I'm Zvinka Zlatar, and today I'm going to be talking about the San Diego Alzheimer's Disease Resource Center for Minority Aging Research, and just sharing with you what we do and see, ways that we can collaborate. So first of all, an overview of the RICMAR programs. There are 17 funded by the National Institute of Aging. They were first established in 1997. The overall mission was to improve the health and well-being of older minority populations by identifying mechanisms for reducing health disparities. The centers are designed to enhance diversity of aging research workforce and also aim to develop research and mentoring infrastructure. And then in 2018, we now have ADRC, which are Alzheimer's disease-oriented RICMARs. And there was a national coordinating center, which was the Gerontological Society of America. That started in 2023, but it was then terminated in 2025, unfortunately. So UC San Diego and others are now leading voluntary coordinating committee efforts to try to still have meetings between all the 80 RICMARs in the country. So these are the 80 RICMAR sites in the United States. As you can see, we have some in Washington. We have one at UCLA. There's the one here at UC San Diego. We have in Texas, Baltimore, New York, Newark, Charleston, Ann Arbor, and Chicago. They have an expanded focus, about Alzheimer's disease. Focus on that because of the rising cases of Alzheimer's disease worldwide, the disproportionate burden in communities of color, and the need to diversify the workforce to address these challenges. So our ADRC here in San Diego, the purpose is to enhance and expand the nation's scientific workforce with outstanding ADRC scientists who are committed to following careers in Alzheimer's disease and related dementias research. We want to understand and address established and emerging multi-level risk factors to develop interventions that can help us reduce ADRD disparities and enhance cognitive aging across populations. So we have a partnership here that's between UCSD and San Diego State University. So some of the PIs are at UCSD, some of the PIs are at SDSU. And we have populations of interest that we like to study in our pilot studies. And those are the Hispanic and Latino population, individuals with limited English proficiency, and refugee communities. And these are our communities of interest because they have increased risk for Alzheimer's disease and related dementias, and because they are important here in the San Diego region, right? Because we are a border region with Mexico, so we have a lot of Hispanic and Latino older adults, and it's the nation's largest proportion of limited English proficiency, and we also are a major resettlement hub for refugees. So we have supported 26 scientists since 2018. So we operate within the NIA Health Disparities Research Framework. So how many of you are familiar with the Health Disparities Framework from the NIA? One person. So the NIA put out this framework on how to study health disparities. This is a modified version that kind of fits into what we do at the ADRC here. But for example, what they stress is that we want to study populations from different levels of analysis, one being environmental, structural, behavioral, and biological. So for example, projects that look at environmental factors could be things related to exposures. So for example, toxins, poor air quality, and how those things could affect aging, cognitive performance, health disparities. Also projects related to healthcare access and quality. For example, how having limited access to healthcare can impact a person's aging trajectory, for example. So socioeconomic factors such as low education, poverty, and limited language proficiency, and how can they affect aging and risk for Alzheimer's disease and related dementias. Migration status. As you can see, there's a lot of things that can go under the environmental umbrella. We're also interested in projects that are, communicating between these different factors. So it could be looking at environmental and behavioral factors, for example. So behavioral factors could be things like coping skills, resilience, health behaviors, for example, physical activity, alcohol use, sleep, and how they affect aging. Personality factors also are of interest in the behavioral umbrella. Regarding sociocultural level of analysis, you could think of cultural factors that could impact aging, that could be related to negative age beliefs, values and traditions, and culture, and how they can impact a person's cognitive status and then their cognitive trajectory. Structural and institutional biases such as racism and how they could impact, a person's aging trajectory. Social networks and support, different cultures usually have stronger or weaker social networks, isolation and things like that, which are related to increased risk of Alzheimer's disease, stress, etc. And then finally, the biological level of analysis. We can talk about any kind of health risks like diabetes, hypertension, medication use, etc., and how they can affect cognition and aging trajectories. Genetic factors, molecular pathways, inflammation, etc. Any questions? No? So this is the overall structure of the San Diego AD-RICMAR. So there is the leadership administrative core. Can you guys see the pointer when I move it or no?
Yes.
Oh, okay, great. That helps. So in this core, they basically have an executive committee that meets once a year, Jennifer?
Well, executive committee is internal, but external advisory.
Oh, you're right. Once a year. And so we are in charge of the pilot project renewals. Then there's the research education component, where we review the pilot projects from the scientists that apply. We also take care of their research education for people who are in the program and the seminar series. We have a community liaison and recruitment core that has a community-driven plan for ADRD research. They work to form community partnerships, and they also have a community advisory board. And then we have the analysis core, and obviously at the center of all of these are our scientists, our AD-RICMAR scientists. And I'll talk about each one of these components individually. So this is our team. The PIs of the AD-RICMAR are Dr. Allison Moore, who is here at UC San Diego. Dr. Paul Gilbert and Dr. John Elder are at SDSU. And then we have admin support, Jennifer, who is right here and who really is amazing and runs this thing. Reja Cooper and Ragda Lajib. So there are admin support. And then all the rest of the faculty here, we are co-leading the different cores. So Erin and I are in the education core. Humberto and Lourdes are in the analysis core, along with Annie. And then Jennifer takes care of our evaluation. And then Tala is in the CLRC core. So just a little bit more about each of the cores. The leadership and administrative core has 4 administrative units. It takes care of center communications. So we have a monthly newsletter that goes out probably to everybody who's here, because it goes out to all the ADRC people, as well as AD-RICMAR. We have a website, we have emails as well where we can communicate, and we send out emails about special lectures and things like that. The LAC is also in charge of being like the glue that holds all the other courses together. They are in charge of scientist recruitment. They track accomplishments of the scientists and then evaluate center progress. And then they have partnerships with the ADRC and other organizations. Yes, they received an administrative supplement in 2024. And then pipeline development. We advocate in research nationally and potential influence as leaders. And then I can read this bottom one because I have a thing on the screen here. They help launch the voluntary RICMAR coordinating committee since we lost our formal coordinating center after the change of administrations. Oops. I lost my ability to move forward. Oh, here we go. Okay. There we go. So the research education component, overall, we provide scientist cohorts with structured training and the mentored research experience. This is co-led by Erin Sunderman and myself. So we take care of the monthly hybrid seminar series where we meet in Kearney Mesa once a month, but also, on Zoom. We have interactive presentations and discussions with our scientists. We always ensure that we cover core curriculum elements that are related to ADRD. We also have skills and career development that we cover in our seminar series. And then it's also an opportunity for the scientists to present their own work, or if they have any upcoming presentations or grants or papers that they want to discuss or get feedback on, they can use that time for that. Every year, we tailor the topics that we're going to cover to each scientist cohort. So we send a survey at the beginning of the year asking for interest in different topics and experience levels with different topics. And then based on the responses, we get speakers to kind of try to match that to our incoming cohort every year, because everybody's very different. And we have scientists from very different backgrounds as well. So we want to make sure that we tailor it. So we also have them, we partner with the monthly Lunch and Learn, which is this series right here. So it's co-hosted by our AD RICMAR and the ADRC. So we help to organize that as well. We also have sometimes additional lecture series or provide asynchronous resources for our scientists. So sometimes we'll have, we'll record speakers on certain topics that we know people are going to be interested in. About like biomarkers, for example, for Alzheimer's disease, and then that's going to be available for our scientists, and we can help them and point them in the right direction to watch different content that may help them. We have a joint annual CME conference with UCSD ADRC as well, and I guess we have a date now, which is October 9th, so save the date for that. And we have invited guest lectures sometimes. This June 2026, we're going to have a great lecture for Dr. Maestre. So we'll be sending more details about that soon. We also help with scientist recruitment and mentorship for our scientists. So the analysis core provides quantitative and qualitative expertise for the scientists and also the alumni. It facilitates understanding of novel research designs, measurements, and analyses. It assists, it assists with accessing and navigating different data sets that we have available for our scientists to do their projects. It also provides individual consultation, and the leadership is formal for mentors to individual scientists. Leads for group papers. Oh yeah, so we just resubmitted a paper that all of the co-leaders of the AD RICMAR wrote together. So that was also led by the analysis core. So it's called Occupational Complexity and Cognitive Function among Hispanic Latino Adults, and we used the Ph.D. data for this. And we also had a poster presented recently as as a group paper. So like part of the analysis score and the record is to work together to try to have grants or papers together as a unit for the ADRC. And development of new writing circles. So we have a upcoming writing circle where some of us at the ADRC who were interested are going to take, I think it's going to be three or 4 hours long, and we're just going to get some coaching on writing and hopefully help facilitate new papers and collaborations among the co-leaders. The co-leaders of the analysis core are Dr. Parada, who's at SDSU, and then Dr. Nguyen, who is here at UCSD. So we have data sets available to our scientists, so they can work with any of these data sets on their pilot projects. A lot of them are, as you can see, you're probably familiar with them, but we have the HS-SOL data set available, data from HRS. So these are all very large and representative national databases. The Rancho Bernardo study of healthy aging, the Health and Aging Brain Study of Health Disparities of Ph.D. They have a lot of biomarkers, cognitive testing. I mean, among these data sets, there's any interest, I guess, that a scientist could have, it's probably going to be covered under one of these databases. The All of Us research program, the SAGE evaluation here from UCSD. So these are all resources that are available to our scientists. Then we have the newest core from the ADRC is the Community Liaison and Recruitment Core, or CLRC. It's led by Drs. Al-Rusan, who is here at UCSD, and Dr. Guerrero, who is at SDSU. Basically, they run a community advisory board. It was established in October of 2024. They have key stakeholder organizations and members of different communities. They have a large focus on identifying barriers and facilitators to ADRD research participation. They want to basically develop trust with the board members, and currently they're working on a manuscript and sharing back with the CAB to help shape, if interested, the manuscript. And upcoming, they have a co-development of community-driven plan for ADRD research. So I think that's been their main focus thus far, is coming up with a community-driven plan for ADRD research that they want to disseminate later to the community partners. So in terms of scientist education, any of our scientists, they could have some engagement with the CAB. And also they have the opportunity to do community engaged research. So that's something that's really important for our center, to really engage the community in the research and then be able to disseminate findings. So the research dissemination happens from community to community, from the RICMAR or RICMAR networks, and the broader scientific community as well. We promote recruitment and retention of Latino, limited English language proficiency, and refugee communities in ADRD research. And there's also participation in an annual community event for World Refugee Day. And more community engagement opportunities will become available. These are our current scientists, the 2025-2026 cohort. We have Haley, Tyler, Megan, and Judith. I don't know if any of them are on the Zoom because I can't see, but hopefully they are. They are all wonderful, and they're working on different projects. Haley's project is related to investigating behavioral, structural, and social risk factors for AD in individuals who experience chronic life stress. Tyler's project is related to factors influencing the association of chronic pain with cognitive decline in older adults. Megan's project is related to hearing loss and dementia risk. And lastly, we have Judith, and she's looking at methamphetamine use, functional resting state connectivity, and effects of age in and education in people living with HIV.
Did Haley start here, or did she find you from Riverside?
She's at Riverside, so she participates remotely on all of our meetings.
You widely distribute the request?
Yes.
Region, yeah.
Region.
Yeah, Southern, there was for a period of time, we were actually open to go even farther out, like we had one from Las Vegas. With this most recent round of funding, they asked us to stay regional if possible, so we do disseminate.
Which has been great, because then we get people with different backgrounds. Yeah.
Yeah. I think that was always the strength, this connection with San Diego State, was excellent to go beyond walls.
Yeah, definitely. So we have 22 San Diego ADRC scientist alumni. I was one of them. I think, yeah, I was actually, I participated in the middle of the pandemic, so it was all remote. I didn't get to meet you guys in person till later. But we have, let's see, so out of our scientists, 13 have been from UCSD, 7 from SDSU, and 2 from other institutions like Riverside. From a range of backgrounds, so we've had people with expertise in epidemiology, gerontology, physicians, neurology, neuropsychology, psychologists, public health, you name it, we've had. And that's, I think, what makes the group really interesting. We always have such nice discussions because everybody's just coming from such diverse backgrounds. Several of the alumni are still engaged with the center, either as co-leads or as speakers. So I know, for example, we have Ariana Stickle every year give a talk. She's also an alumni of the program. I'm now one of the co-leaders, and so is Tala. We're both, we used to be in the program. So it's nice to have that community. We work on collaborative grants and publications, and our scientists have also ended up collaborating on grants and publications, which is great. So they are networking and helping each other succeed. And we did an alumni survey. When was it done, Jennifer, the survey?
Yeah, we did the survey. It was voluntary, but we did that by January. So
but it was this year, right?
Yeah.
Okay. Yeah, so the survey that we sent out to the alumni, basically just some descriptive words that they found it uplifting, supportive, transformative, career shaping, fostering, caring, and the impact of our program is that it has helped establish our scientists as investigators, independent investigators, and a lot of them feel they develop lasting and strong professional networks. The program has opened up new opportunities for them. They've had ability to develop new skills, and that the pilot funds have helped them for getting preliminary data, for then applying for larger grants, generating new hypotheses, gaining access to all of these databases, and greater ability to publish. So for our recruitment for the 2026-2027 year, we sent out this flyer that you can see here on the right. We explain the benefits of the program, the eligibility criteria. We send it out via email and word of mouth. And then we initially focus on candidates that, write back to us with interest. We get their CVs, their bio sketches, and we ask for a personal statement. And then based on that, we invite some of them to actually develop proposals for the ADRC. And the faculty from the REC and other faculty in the program, we help the candidates develop a pilot proposal. And then every year, the goal is to recruit a minimum of 3 scientists. So this year, we were lucky that we are getting to recruit 5 scientists. So we have Dr. Christine Dell, who's a research health scientist at the VA. with a project looking at intra-individual variability in Spanish language cognitive assessments. Aram Kim, who is a professor of exercise and nutritional sciences at SDSU, and they'll be looking at mobility-based decision-making as an early behavioral marker of cognitive decline in Parkinson's disease. And this is great, as you can already see how we have people with these different backgrounds and different interests. So I think it's probably been a while since we've had a project in Parkinson's disease. So this is something exciting for the center. Francesca Lopez, who's a postdoc at the VA and UCSD, will be looking at contextual adversity and cognitive aging, psychosocial and environmental pathways to ADRD risk. Carlos Rosas, who's an assistant professor at CSU San Marcos, will be looking at psychosocial factors and cognitive health and doing a risk resilience analysis. And then Dr. Tabia Springsteen, assistant professor of psychology at UC Riverside, will be looking at differential exposure and vulnerability to contextual stressors in daily emotional and cognitive functioning in older adults. That's a mouthful. Okay. So what are the benefits of being an AD-RICMAR scientist? Well, we help the scientists with a pilot funding. So they receive some funds to be able to conduct a pilot study. They get a very strong mentorship team and peer support. They get research education through the monthly series. They gain methods and analysis support, and we help them navigate these large data sets that sometimes are really hard to, get a hold of or understand the variables. They also have access to community engagement research methods, and they become a member of a local and national RICMAR family forever, basically. There's a lot of interdisciplinary collaboration. There's opportunities for attending conferences, and we can cover sometimes travel funds for our scientists, and ultimately assistance with increasing their publications, getting additional grant funding, and we help them with their career advancement as well. In terms of our collaborations with the ADRC, like we mentioned earlier, we have the Lunch and Learn series where our alumni and then scientists from the T32, right, from ADRC attend as well. We have joint workshops with the ADRC. The last one we did was last fall. And then the next fall in 2026, this fall 2026, we're going to have another joint workshop. The aim is to host annual joint workshops, and so every year, hopefully. We also have joint faculty between the centers, me being one of them, and I'm also part of the ADRC Latino Core Assessment and Innovation Core. And I'm also one of the co-leaders of the REC for the AD-RICMAR. And the REC scholars from the ADRC are invited to our seminar series, and both programs work to maximize the support of candidates. So we welcome additional collaborations. And I believe that's it.